Good morning, everyone. My name is Sima Sahar Zerhi. I'm the Premier's press secretary. Today is Tuesday, January 18th, and we have our COVID-19 media conference. As usual, we will begin with a statement from the Premier offering today's case count. We'll follow with a statement by Minister of Health, Mr. Main, and the CPHO will be available for questions and answers, and so will Minister Quassa, our Minister of Culture and Heritage, who will be offering additional details on a new COVID-19 initiative. Thank you.
January 18, January 19, Mitsano Kalimanela Mimata, Nasibulik Pigala, Lunehat Silik Mangata, Malo Minister Maino Kalimasitako, Tanana Hanituli Mariatu, no longer Apexocta, Malo Minister Quassa, Nalunay Lang and Major Pillar at Misakata Uni.
Koyaname Uli, Koyaname Sima, Udako Paka. Nunavut mutate pilong watame inyakulupon nala tuin ubrango yong pigiako takapunga haswalo ukumaitumen ubrango yong nalunero nasivugo dipasya unwango lotong Nunavut mutakolong kayu silauman nuwan no jwa pijutigidlugum taman sivul tapare vavon nuwan no jwamon tan Omicron sakpelautidlugum isumagi vavon ilakulungin nunale isumagi vavon taum udrango yung nalunero nasivugo Nunavut iliwane 177 ngoloto nuwan no jwa hatum tako 17 ngovo nunale atuktaw simayum 32 ngovo akveanen 33 ngovo kamanituamen 11 ngovo Iqaluit ataw siuvo idlulugardunen 13 ngovon sadlernen 0 idlulumen 11 Iqalunen 2 uksoktomen 21 kinganen 2 kugardunen 11 nauyanen 2 pannotomen 1 mittimatalemen 0 krikirtarduamen 17 kangetlenumen 3 sanrayamen 11 sanikiluarmen 4 talodruanen ama 2 tikiraduanen udlango yo nalunarsigum nangipogon mami simayukisiane katilimarlewe 307 yovon nuwan no duakarun no simayun tana sakilaw simaningan Nunavut iliwano udlango yo kobaya sutiapunga Nunavut government panda padangin nasimama kano Iqaluit nang Iqaluit mangata nuwan no jwa 19 pijutigidlutigon udlango yo kobaya sutiapunga 375,000 pulago kanel kinaw ye nunalenyo tusaumatitiliriyitinno toranga yun sakigun namnagatam takwa nunalilima nirigun napon $15,000 ne parna simaviunatum Kauyimagata, Tusaumayi, Ila, Tusavi, Nunalitin, Hanutege, Pimariuning, Tusaumatilirinum, Nunavut mutakulun, Piluanguatome, Nuvan of Zwap, Pijutigidlutigum. Tamakua, Kina Yen, San of Vataunatum, Aulaning in Yun, Valone, Ikana Yatita, Unamning in Yun, Tuanga Unamnatum, Tukisigato Kanaruman, Ilikusilikon. Kakasyaw yakut titirafigun natun chfunds@gov.nu.ca taikan nodlego chfunds@gov.nu.ca uvalonin akikangitukun ukalagun napon 1-866-934-2035 taikan naruko akikangitukun 1-866-934-2035. Koyan namero matiapara Minister Quassa tasuminga asawakatlun sakigum nasimagatam. Minister Quassa atuinaw napo apakoti sakatokan naron tasuma Iqaluit nato Nunavut mutanu. Tusaw takabitin nuilam. Udlango yuktau kuya suptiapunga nalunarun nasimigata government kwakkun tussaqarvigilau simajatin nalunarun nasimagama kiugun nasimalilaumata pinasuarusiulortum. Minister Uluanatumi Jacob Timon, Minister Blair titaqamin uvannu kiugun nalauman pinasuarusiulortuila nalunarun nasivunga government kwakkun Nunavumon atuinaruisimaniapon pingasune aniasutinin takua pingasuit aniasutin Nunavumme iqanayaqattарsimayun qauyumattiarlutillu amma 9 qauyisartimmarin qallunaatitu contact tracers atuinaruqtaunaattu takua Statistics Canada kunnen iqanayartiugaluan uvattinnu tuniyaukainnersimanaattum takua nalunairum narsivavut udlaanguyung qauyumatlutuatluutaana illukissarnerpu Nunavumme assualu udlumimu saqqiyaartittisimamma uluaanartumitittisimamman tamanna piluanguartumi nuvarnertuaq amma puvallunne uqauserivalliallutigu nunalittinni niriuttiarpunga government-qakkun taana ajortuiqatigigumnarniarnitta taana pimmariuguttinigi simagattigu naluneerpallianginnarsimatlutigu Nunavuiluanen Nunavummiutanne udjorsoqujittiarpunga taana allarvettinnu pinasuarusseriattinni uterpallialertillutaila kajusiinnaqullartaarama taakkua nikagusunnittinni angiqarsimagunnarussi angiqarsimallussi inugialuarteilekujausimanneen malittiarlutigun kaportaugunnartu kaportauttiarlutin kiinarmi matuarsimagialeen matuarsimagunnarlutin amma taana nuvannertuaqaqasugiguvin taana uqaalujauqattarluni nalunit tauttiarniamman taana iqqaikannerutigigumattiarluguila tunga naqatigiinginnar reaqaqatta assorunartukkuuqaluartilluta taana assualu pimmariummaila innuqatigittiareaqerniarnitta so quyannamerumattiarpunga taakkununga Nunavummiutannun so quyanname. Good morning. Good morning to Nunavummiut that are listening, especially those elders that are listening in this morning. I am very saddened to begin this announcement on a somber note. Last night, one Nunavummiut passed away due to COVID-19. This is our first casualty in this wave. So my thoughts are with the family and the community. As of this morning, Nunavut has 177 positive cases of COVID-19. We have active cases in 17 communities. The reported numbers are 33 in Akvian, 33 in Baker Lake, 11 in Cambridge Bay, 1 in Chesterfield Inlet, 13 in Coral Harbor, 0 in Iqaluit, 11 in Iqaluit, 2 in Johaven, 21 in Kingain, 2 in Iqaluit, 11 in Nauyan, 2 in Pannerton, 1 in Pond Inlet, 0 in Qiqirtarzuang, 17 in Rankin Inlet, 3 in Sanarayam, 11 in Sanikiluang, 4 in Talorjuak, and 2 in Whale Cove. Recovery data was not reported today. There are and have been a total of 370 total reported recoveries in this outbreak. Today, we are announcing another initiative as part of the Government of Nunavut's COVID-19 response plan. We are providing $375,000 in additional funding for the community radios in Nunavut. Each community radio station will be eligible for $15,000. Community radios are a lifeline in our territory, helping in disseminating and providing essential public health information. These funds could be used to cover the operating expenses such as salaries and the purchase of equipment. For more information, please contact the Department of Culture and Heritage and chfunds@gov.nu.ca, or call the toll-free number at 1-866-934-2035. I'd like to thank Minister Quassa for this work. The Minister is here to answer any questions regarding this initiative. I am also pleased to announce that we have heard from the federal government regarding our other COVID asks. Minister of Public Safety and Emergency Preparedness, Bill Blair, issued a response to our letter late last week. The federal government has provided Nunavut with 3 additional nurses, all with previous experiences working in Nunavut, and 9 contact tracers. These are Statistics Canada employees. The housing gap and overcrowding in our communities continue to escalate the spread of COVID-19 and tuberculosis in Nunavut. I urge our federal partners to collaborate with us to identify a pathway to addressing Nunavut's housing needs. I want to remind Nunavut to stay vigilant as we return to our offices this week. Please continue to stay home when possible, stick to your small bubbles, get vaccinated, and get your booster shot, wear a mask, and alert COVID hotlines, and isolate if you have any symptoms. As always, be kind. We are all in this together.
Blachak, he would look palming Eli Hartut, Nunavut au Katibut, Ikpiga Katigit Lugit, Nagligit Lugitlu. Ayok Namat. They might pakak, and now they did it Chinakumut, Malikto Yareli Nutat, Malili Lauraptigo. Katit Tatu Luan and a young in Nunavut, Malu, Nang Minapilari beat, Ukwertang to Luan and a young it. Amalu au latang nera yudu akaput nunali ahingit nut ahengok himabut kahutera himabunila tamakwa maliktau yarelit kihieni kahutera tau himagaluak tisugit malitcha tuin nau ya koigaluak punga maliktau ko yau yunik atulak titau himayunik kapiyau tarlutadlu kapiyau yudu arangapta an elerikut tau yumut nuwang nalramut Amalu aulaga karangap tainat nak nunadi ahingit nut aulag takluta taman na nuwang nalrakang nak nauyok nunabu iluani ingakap mahudi pilaretuin nakakakpugut tamapta ukwa nuwang nalrualit amihuningit katakpala kulugit amma taman na anigud lakin nakuslutigo kuguptigo kubaya huktung aulak unikatu luarama Inutokau hibiu Mikanut Embassy West, amna Ottawa mitok Mikanu. Tuhak tiyu luang amau blak, nunabu miut inutokait, nuwang naluakang nakaktaulak tuluktat, kanuigun na kimana nakaktaulak mata, mamihiman nakaktaulak mata ilak. Tema hitamat nunabu miut ilagiyauyut, tabungay kayo kaktok himayut, man namutikit lugu. Embassy Westmount amalu pinahawa ko hagayap tinik ataw hikkanang minunabu miutang mik ilagiyaw yung mik tabung aktokang naksuni adawa miutaw kataktut makok ilagiyaw yut ikayok takibut tekani Embassy Westmount ilagiyang minik ang vianili inutokaw hibbik giyaw yok andi aulad jut inutokaw hibbianik Inutokang nik teikan yang miutaw yun ni huli kawiyaw yo kakhimang itok nuwang nalra kang nakaktaw yo kakhimang itok mana mutikit lugu amalu pilirayi ta iluani nutanik kawiyaw yo kakhimang itok nuwang nalra kang nakaktaw himayunik Inutukaw hibik akwenik pekotinik atok negang minik ile atugaw takudluang na aktunik tikibiu himanik tut ay toluk to kakonago uktu tikitlugit matuat it yakotit N95 hunagagawut amma ahingit pekotit tabung audlay yaw himanik tut Kotong mili inutukaw hibiu mikanut Tema January 13 ngutitlugu tuhak titawli lo kapta mako pilagayigi yaw yut steakani nuwang nalrakang nakatawli lo mata man na mutikitlugu inutokang nik tekan yang miutaw yunik huli nalunayak taw yokak himang itu nuwang nalrakang nakataw himang itu huli malu taman na kanuing itya ko yun yang mo pilagay na yang nakaptigu inutokait tekan yang miutaw yut kawi hak taw yang luwit kanuing itya mga tadlu pilagay katigin na yang luwit inutokaw hibing mi pilagayit amma inutokaw hibit tamang men okaw heret lugit pilagay liungit tut pilagayit amihuning kanuing ityak tu man na yo matna Oh, my light went off. Good morning. First of all, I'd like to offer my sincere condolences to the family of the Nunavut resident who recently passed away. My condolences. Yesterday, the new public health measures came into effect in Nunavut. We have increased gathering sizes, allowed businesses to open, and removed the travel restrictions between Nunavut communities. I urge people to continue to follow the restrictions, get vaccinated, and only travel when absolutely necessary. This outbreak isn't over, and we all need to do our part to ensure the number of active cases continues to drop. I'm happy to report that all Nunavut elders who were diagnosed with COVID-19 at Embassy West have recovered from the virus. As of yesterday, there were 4 essential caregivers from Nunavut at Embassy West, along with 2 family members who live in Ottawa, providing assistance with essential care. Another caregiver from the territory will be arriving later this week. Elders at the Iqaluit Center in Iqaluit continue to be COVID-free, and there have been no new infections among staff. The center has also received additional PPE, personal protective equipment, such as N95 masks, visors, and surgical masks to help with infection control. On January 13, 2 staff members at the Joe Haven Continuing Care Center tested positive for COVID-19. So far, none of the 9 elders at the center have tested positive and have not shown sign of symptoms. We will continue to test and monitor the elders. And finally, staffing at all of our elders' facilities remains adequate at this time. Matna.
Kent Driscoll, APTN National News. I'll start with Dr. Patterson, please. Dr. Patterson, I know at this early point you're not going to tell us much about the person who passed away from COVID because you're still contacting family members. Is there anything more you can tell us, whether a broad age range, any sort of pre-existing conditions that may have attributed to this? How much more can you really let us know?
Kent Driscoll, APTN Kuniluta Patterson, Tana Inugum Nekayo Michano, Galagum Nagovetak, Hanutu Nasurloki, Hatsu Namangata, Balo, Hakaningo, Hanimaguta Hatak Namanga, Hano Hausarikan, Nagum Nakyo.
Right now, we're not going to discuss anything about it simply because it hasn't been 24 hours since this happened. So we're going to let the family grieve and deal with it, and we'll discuss further details on Thursday.
Mana yo hau siritsang itang hilami uluang ikakay 24 na halaw ng mataluni tay kwa hitsa kumatay lang itakwa kay sitamang may hau sirigyakan na nalaktakalong.
Dr. Patterson, I've been hearing anecdotal reports of people getting their rapid testing at the airport once they've arrived here in Iqaluit. I'm wondering, where are you as far as rolling out those tests at the airports? And I'm wondering if there is going to be an opportunity for people to receive those rapid tests at home.
Luta Patterson tang naguto sa hatak si mamahang tayo ko bimikalo ni tikipalyayo kawi saktaw hatalang ngata taman na pigyak si malag mga.
Thanks. That's part of what we had announced a while back, that travelers will be given 2 kits to use in that period shortly after they enter Nunavut. As far as making tests available more widely, that work is still in progress, and it depends in part on when we get the supplies that the federal government announced recently.
Taman tagaw seryo jago na luna tigo tay ko tikipalyayo makko ni kawi sa kutin yang ka nito ni yaw katalang ni Nunavut mo tamako tikipalyayo. Tako elekik ko tuin nam nato itnaw titaw na mga tasuli taman nakamagiyaw mamalugawa matokak ni tikisari yaw si mayo piyaw si malakata.
And one important bit of information for everyone who gets those tests: when the tests were originally manufactured, there was they were printed with an expiration date that makes it look like they've already been expired. Health Canada has been monitoring those tests and has officially extended their shelf life. So even though the tests are printed as having expired, they are still reliable and they're still perfectly acceptable for Nunavut to use.
Tana tapi Mario yo kawi mayaw gari tamakunungang kaw jagaw yun no kawi sakutino. Tako sana yaw gari nga tilugi titiraktaw ng kano tamako isulit tabit sa nga piugun niya bit sa nga kisani ana hamang itulir yung marikut kanata may kawi sakpalangin nga tatamako nga kawi sautinik tako isulit tak biu si magalo at tilugi atok tawgun nak ni isulit piut siya kuno na bumiyong sulatok tawgun nak to.
I'm a transfer to the Canadian Press. Yesterday, Canada approved Pfizer's antiviral drug for COVID-19. Will Nunavut be getting any of that drug? And if so, what will that look like?
I'm a transfer Canadian Press kuni government of Akeeagok sila ngata Pfizer me isa gang me nuli sa te me Nunavut Joanna Quassa mayunutak na Nunavut matoy na hulaka.
Yeah, we will be getting some. Our understanding is that as shipments arrive, they'll be distributed to each jurisdiction in proportion to the size of the population, and we'll be using them in accordance with we'll be following the guidelines that Health Canada lays out for their use.
For people getting sick. Tamako tikitaw lato atuni kana tami abitok sa mabiyo yun na ulap titaw katalalang nga tatamako akatsi yun ibu inokam ningi malitugit takunungan nuba Joanna Quassa mayo numalitaw luti malitaw gali tako ijagay atok taw katalakto.
Our understanding of the medication is that it's used after people already have COVID-19. It reduces their chances of having severe complications like medevacs, hospitalizations, and death. But it is not in any way a substitute for vaccination or for other public health measures, and initially the supply is going to be small.
Tako ijagay nila nuba Joanna Quassa minyo yun tuniyaw hatalang ata sulu tamako nuba Joanna Quassa mayo kanin malwa video ako nagit ubalo awlak titaw ko nagihang atayo ko ubalo uni ko nagihan na balon no toko ko nagillo tako kisan kingong beauty ujang itu kaputi mo ambalo na hamnang itulir na mo malitaw galin ni katsinaw gangarlo tikitaw lakata.
I'm hearing reports of entire households testing positive for COVID-19. Can you tell us how much higher our case count actually is than what we're seeing in the numbers reported every day?
Tusasima tako illumio khatigi atangirtugi nuwadjuanarta hattarninginni tako ilang inaasartauqartarunni qallaimata tamannaaqanu isamagivio.
It's certainly higher. It's hard to, like every other jurisdiction, it's hard to accurately estimate the magnitude of the difference. What we can do is using the numbers that we have available and comparing them on a week-to-week basis, both the number of tests and the number of households that are affected, we can get an idea of overall trends. Is it improving or is it not? And that will vary by community or from community to community.
Tako nalunang ito niya misunasaugalo at manila yung nangatay machay na kanatay mami katsilatango ningini kamalu tako kanutigi tamasi maningini isa nasaktaw si mayamana yu atok tugi pinaswa ko si tamata ko kawi sakpalya hatalang ayabo malunal ang lumio katigi nuwadyo anak to mangata asidjak palya mangata katapalya mangata balo taman na jigi hatta jangi mato ni nunalin ni isa na kawi sakpalya ang nalang ayabo.
Teresa Hetchuk, CBC News. Maybe this is for PJ. Ipacha Nunavut government nalo na sila doe ikanayzak dingi alla binno terunnak ni kaychute kisiani talirmiutil logo ikanayzak dilima Nunavut government ni titikak biula doe hakitawzakko hawjawchute ane kangini kanayzak unnak pata ane kangini khuzawchute ane kangini kanayzak khuziguchi ane kani summale ilinyak bino na vumi matuirtaw kaswaka. The government lifted its workplace restrictions yesterday, but on Friday it sent an email to all staff encouraging employees to work from home. If working from home is still preferred, why open Nunavut schools?
Yeah, kuya namin tan apakutia valong tako minister tin asukud latamata kanok tako kanayativu piluang watume pinaswa ko so yatten utapadiagum na ko yawle mata tako minister Lightstone unikakatia loktunigin titirapadiang nasimayo tusaw matitin nakata kanok pangnaw takapadiang mangata kulago kanotana minister Gross naloneron naksidaw mapinaswa ko sa mitako ilinyarvi kuluvun mapakun napadlia si manyaningin pinaswa ko sa yatten kakasaw yakko si makain ng namata kawji magat amisyon ikanayativu kitungwa kang mimata ilinyarvi min government do tukisi umatiaga tatasumenga so tema titakakote ikanayatulagi kuninga yutunga vekatlamna titakaf simalopo tukisi umagat tamang mealo ikanayagum nakajangitun pidju takatlote piluang watume kitungwa kang mata ilinyaga atun apakuta kang namata ila so tanda tukisi umagutigi naw yasimagatigum iligutigi yasimadlutigudlupina atukattasimagattigu tamanna nuvannerjua tavunga Nunavut mo isarsimallerlunu ila kisian pinaswa ko siulatu niruppiarpugu uattinnarniarlutallu ilinyarvikului mappilaarniarninginni tako ilangin nunalin avvatuangin pigiarutagi jaunammata ilangin tamamme kanwigate nunalin mapperniammata tako taiyautti niruppiarpugun Minister Gross tasuminga tusartittikkannerunnarniarningani. First off, I want to say thank you to the question. Minister Lightstone outlined in terms of our openness to work with all public service. I think to your question of with the advice of Dr. Patterson, our ability to start opening up the offices is something obviously we work very closely with. And then obviously with the Department of Education as well, which gets really the direction from CPHO of opening the schools, realizing that there are many public servants who have children and the impact that opening up the offices as well as having the remote learning for this particular week, there'll be issues. So that's where the Department of Health has Department of Human Resources has provided a bulletin in terms of the employees, and I think Minister Lightstone could provide much more specific details in terms of that particular one.
Takwa government hakkunot winno ti dawlanga zoi anya siokti pilirizilo khanga tikilakha amalo nami khana isakti dawlakha. We heard the federal government is providing the nurses and the contact tracers. When will they come to Nunavut and where will they be working?
Matna, take anya siutit na yungwi kaku tikinnya mga tao kak na yok tunga man no yo kiheni kak tu luak tunga at elite chiku bluta akikui badle yugu namut au luak titaw na mga ta ikayok tau gya elit na yungwa kilyok tu na yungwa ila amihong iluak tu na yungwa kak tu nunali amihong mata amigak kayu amihong mata nallen utorak ti tawna mga takiheni man okang na yok tunga ukua li ahingi kawi hak tu lagay nang mopilagay yun to contact tracers nunabu hilatani tuwin nakalwak ti pilagay ti tawna to so at this point I can't say exactly where those 3 nurses will be going. We are health staff are working with the federal officials in terms of deciding where they will be deployed. There's a bad need for additional nurses in many communities in Nunavut, and so they'll be deployed to fill some of the gaps that exist. As for the contact tracers, they will be working from outside of the territory. Their help is much appreciated, of course, but there's no need for them to physically be here in Nunavut.
Right now, can you tell us which communities need the most help?
Nadliat nunaring tukak titaw na mga tadik ko na yung nguyan niya siutit kiheni o kalaw kama hanateli ako hiulok tumi kulit nunalit an abing itaw tuklugit tuwabang naktut kihimi takuyaw talok mata taman na maka tukihibal ako tigiyaw yudlo to kanok kanutigi akko mga apta na yung kileong na pidutigi lugo. I can't say which community has the most need for additional staff in terms of these nurses, but I can say, as I mentioned last week, that we had 10 health centers at the community level on emergency services only, and hopefully that can help illustrate the need that is out there for additional nursing staff. Thank you.
Trevor Wright, Nunavut News. Is the Department of Health looking at similar incentives for lab tech staff who do COVID testing, similar to that of nurses?
Trevor Wright, Nunavut News. Kuni takwa na hamnang itulari ko sumasasyo ka takwa kayo siya takit sinang mga tao ng sibin ni kaya sak ni tema sa inaan na siya dito.
The last round of retention bonuses was in 2021, so I can't say at this point whether on that particular question, I don't think it would be appropriate to single out, considering the small numbers of employees in that particular profession in lab technicians. I don't think it would be appropriate to speak to that level of detail at this time, but I can say that, as a department, we're continually looking for ways that we can show our employees how much we appreciate them and how valuable they are to the communities that they work in. And, that includes but is not limited to incentives or bonuses, as you mentioned. And it's no secret that our staff have been under a tremendous amount of stress. Many of them have gone above and beyond in terms of what they're delivering to Nunavut, and it's really a heartfelt appreciation that I can offer at this point in this press conference, and I hope that we can offer further ways to show our appreciation in the future.
Thank you. Next question is for, sorry.
2021 mitekwa ikayo sa tarilo nga tahakan nga gumana yu tako hausrilo aron nang itakakatsina mga tatakwa ila katsina mata ang Steven ni kayo sakti yu tay mailulingin no kalimagud na jangin nama kisa ni piliribitin ni kayo mayugo khuya gitsa katigo tako hanutigi at suru tahas maningin ni tay ma ikayo sa tigwin na ito khuya giyaw gumnang ata Amalunalo nang itsa sunita ko at suru te hahatak si mamate kanaya nga takakan ni nga piliri yung mareo hatak si malutino na bumiunod. Kisa ni manaw yung matini nga tumihuyan na mayroon na tiyo natakka.
Next question is for Dr. Patterson. You guys recently changed the isolation time for vaccinated for people up to 10 days. In layman's terms, what recent evidence points toward shortening that isolation period?
Mana mangulaw tutako hanutigia ni telikay na hatare hakpito yun nailigar taulong at taulong itako nung kapayaw si mayono kiso ni pidyote haktuti kawiyaw si mayono itaman na temay tawa.
There's mounting evidence that people who are fully vaccinated clear the virus quicker than people who are unvaccinated. So in terms of how long it takes for them to be no longer infectious, the time frame is shorter in many cases, but not every case.
Kawiyaw na si malang tukisin na si matsyato ni tako nubadyo anak tao si mayon kapayaw si mayono Hilamiw ng sa kanigun ni ko tsakasyo ng ningin tayo mga ni kapayaw sa mga itunik. I forget the rest. Sorry. Go ahead.
This is a question from Melanie Richon from Nunavut News. Can you provide an update on how many hospitalizations there are? And she has a follow-up.
Melanie Resho nunat sa news kung nito sa sigari hatsyo mga tao nit si Mayayan na balon no.
10 in total so far.
Fully.
Are some of the hospitalized cases coming from the same communities? And are there any communities you are most worried about in terms of how much community spread you're seeing or how severe the symptoms are?
Takwa unit si Mayana belo ni tako nang at China nunalin ni nga si maba. Nalay sa malugin na pa-review nunali sa makbiyo pala ang nakpangon ni nga.
That's 3 questions for 1. The hospitalizations are from a number of communities, and no community has had more than 5 hospitalizations.
Jiging ito ni tako ana belo mo nit si Mayoy nunalin ni nga si Mayoy katilugi ato ni nunalin ni tali mayo nga tano si Mayo hakatang ito unit si Mayo ni nunalin ni nga ato mi.
I think right now, I think every community has certain risks or has vulnerabilities in certain areas. And so it's not appropriate to frame it as being more concerned about one community than another. And I think the important message is that it can get to any of the communities in Nunavut, and that people manage their risk appropriately as best they can.
Mana yung ila nunaliliman uluran up to me nakangata sa mabiutuin na kaham ningin ni tayo may Ukausirigum nangitaka nalia nunali isumaalugin na pare mga kuser magbiuga yarningani kisani pimmariugo kaya mayauga harningi tamakkuan ila nalia ano tuin na taman na isarum na nunalin tay mga takwa tunin aulat sihatang na nga taulugan naktumitay katigiluti.
I'm sorry, I can't remember. Was there more that I missed or? Okay.
I have questions from Donnie Alec from Iqaluit Radio. The first one is, with the new testing requirements, when cases drop to zero, if we're not always testing everyone, are those cases in those communities actually zero, or there might be cases we just don't know about that are being not publicly reported?
Kuga nalaw tikong inni takwa nuta kaya sakta gutiyo katta tumalitaw yali pidyo tigilugi. Nuka Joanna takakon niyang nakataupan ilang kaya sakta katta tinagita ma kanunalo na kaya nga nuka Joanna takakon nila ni kaya sakta katta tinagi.
There's always weaknesses with testing in every outbreak. Every time we've had COVID in a community, we hear of people who are symptomatic but refuse to get tested. And that's much more of a concern than knowing that there's potentially people in a house where we're following them and diagnosing them based on symptoms. But that's been a factor throughout the pandemic.
Taman ayong na inasus kangatuin na sa maktuhak pala tilugo tusak sa mahatakata ima hanoy ko takakalawak ti ilang kipilo katanga takawi sakta gumangit sa tuti taman na isamalon nam naksaw katak tu tamakko ilumeo katigino takwalo naluna taw katak naksigalawak tilugo hanoy ko takamningin no wadjo naktuham nang
In follow-up to that, I'd encourage everyone, if you're out and about and feeling unwell, please isolate at home and call the hotline. We need to, we want to find every house that's got COVID if possible.
Kisani tamakko kikutuin na yung hautiga kanoy guti katwa ko be kani mayuya ko be ani tailit sautigi siga kaktuti ang ikatsinni tanalo ungasit tumo kakangit tumo kalat sautigi lo sa kawi saktaw na akat si tamakko nalle ilumeo katigi kawi mana akatigo nubadyo anak tuli.
And her other question was, she's heard of people who are in isolation not receiving their hamper until their isolation was complete, and they're having people call in the station for food donations. How are we going to solve this problem?
Tusak si mayuta ko ani tailit itaw yuta ko payutaw katangin matago ilangi nakini pipyarili kay matakisyan ilangi nariyat sa katsa ko ni katang matago.
Ya, kuyan na mitan apakutieva tan tema pinaswa ko si ulotro tako nakin aswalo pimari ko tigi yaw tu salawata pinaswa ko si ulotro me tan nakinaw ye sanok vai kan nakon nalawat tigon nakin tu sakatta king vaksimat lo pitwa vang nattu gol watilego so tan Akeeagok men sakki si malagatta naruti apunga pinaswa ko si agpadliana tan sukkan sama nakin paju katakon nang nernitya tan tusaksi malawattigo tema Akeeagok men nan silaw pugun so kuyan na mitya pakatako tusarlutigo kisian Akeeagok kay naw yamman so tan naruti apunga ako na tema utakki ko gumenangin mata piluang waktu mangi kaksi makuyavun pidjutigidjotigum. Thank you for bringing forward that concern. I was very pleased to be able to announce the additional funding required to bring more resources in terms of the time delay we've heard right across the territory in terms of providing an essential food hamper to folks that are being asked to isolate. So with that, I'm hoping with the added resources we've provided both to the hotline, both to the email that I provided last week, that our response time in terms of what we're able to provide to Nunavut that we've asked to isolate, I'm hoping is shortened. With that, I encourage members that are asked to isolate to call our toll-free number, but also provide an email in terms of the request for food hampers. And with that, I thank the member for bringing that concern forward as well.
Kent Driscoll, APTN National News. Minister Main, please. Minister Main, I want to revisit Trevor's question about the lab techs. You talked about showing appreciation for the employees of the government in Nunavut. Traditionally, the way the government in Nunavut does that is with money, at least for the deputy ministers, assistant deputy ministers, and senior staff. Last time IA tipped it was 2016, and you were paying close to $1 million in bonuses for senior staff a year. Looking back in retrospect, do you think you should have spent the 80 grand and kept the lab open?
Kent Driscoll, APTN kuno tako ang sabihin how isakti pidjutigillugi tako kuyagi nang nakakatakabigi. Nunavut government kung kuyali sungu matali tamakkuning ang yokkautinu sulu minister itulingin no ikayoktingin nullo. Tan nakawigalaw mama 1 million nung atani tako hakaningago ikayo sakta hatak timini tako ali suma 80,000 natilong ila tako nokkakunagi ang yasi. How exactly?
Matna iken matna perigo bit hiul lapami te pumani minister langit nama kanwileo kaya laok mga ama te pumani apereko bit okang ne ayok tunga te pumani minister ngilaw ama atong ni kuwinyang ni to hakta kemayugut yeni kana ubanga te kwa kang kemayut kanu nang mina ihmagip mga kiman okang ne tunga iheni okak tu luak tunga ukwa okaw herelo katit gavamakut pilagayingit nuturanga titaw hoktut senior management bonuses hibulak tigiyapta abiktok himan neriyata kamagi hokmagit so Executive and Intergovernmental Affairs, okaw heranyayok miyak katekwa, okaw heralaw katit, kiheni man na ministry ulakti yunga, kinyak tunga, kano, kuya linyagayap tinik, kano, takutit siyu luareka, pilagayigiyap tinut, pilagayhimang liwak mata, ikayok himang liwak sutit lununabong miutanik, kina uyak tigu gumang napat ubaluni Akeeagok gumang napat kanu kya hak kaya kakumako tu tak kini kay unik kanu tigi kuya lihim mga aptan gabo mau bluta ko antna te ditsi kupilari takut lugit. I'll try to repeat myself in English. So first of all, Ken, I wasn't the minister at the time that you mentioned, so I'm not going to go back and put myself in that hypothetical situation. This is what I would have done. So I can't really respond to that part of your question. And also I'll mention that the senior management bonus system is run through Department of Executive and Intergovernmental Affairs, so I'm also unable to comment on that aspect of your question. But I can say that as minister sitting here today, I am very interested in finding ways to show our gratitude, to show my gratitude to the staff within the health department. We've spoken in these conferences about the effort, about the contribution, about the incredible service, life-saving in some cases, that have been provided to Nunavut. And I think it can't just be about words. It has to be in terms of the health department. What can we do for our staff to show them how much we appreciate their efforts? And it's not necessarily limited to financial incentives. There could be other things around workplace, the workplace, listening to the employees in terms of what they need. So I can't offer any specifics on that, but I do look forward to finding additional ways to show our gratitude.
And this next one, you might be able to handle this. It could be the Premier. I'm wondering about the request from the federal government. Is there anything outstanding on that list? Is there anything you're still waiting to get from the feds?
matna makakiu law yag lunga hebulak tikiu ilagya kanang na magu kanui kangin na ubin titakalau khemati lugu hebulak tigi jabut pilagay kanang ni huli aperilaw kalwak tugut kiheni iluli luktang ni unikane ang itungo galwa matna awak lugi gabumatokakut kiu law matigut amma kayo tik kanang ni hakke himak matamat na khimat lugit te mak nuwang nalwa pigelaw ti yugo nunang lwa mi nuwang nalwa khang nang man na mutikit lugu gabumatokakut no kayok daw himak lwa kapta koyali himat lakik tunga man no yo so there were asks in terms of our staffing complement that were not responded to in the letter from Minister Blair. But that being said, the assistance from the federal government will go a long way, and we really do appreciate the assistance that's been provided since the beginning of the pandemic by the federal authorities in terms of helping Nunavut to respond. And I'm going to let the Premier add to my answer there. Matna.
Koyan na me rumatia me government okakon ta udlume yo naluna sigum nakata kawi matia kata kanata le mame sitat jual mame ami garnangin biduang wa tume anya sortin kawi sartin tan naluna sigum nalawat kanata le mame ami garnangin so tabuna koyalitia punga Minister Blair naluna sigum nasimama ikana yatini ubatin sanogregum nasimani aninga ipigi jautia tan ukiu tatung mi utau tutam uluan atu mi kan rotinga sakya katasimaman tan tukisiu maningin koyalit yapunga naluna simagidleu ni leu titaka ubatin nutuni yau yong ilangi aulagun nakatigo tusrare dau tavu walwa naluna ngito Minister Main khimekukan nato kana yatisane piluang watu me ania vivun salumagi akhningin tamakkuarulu yaumata namminerte qimekukanneraahernia qurtavun neriutiarpunga Minister Main assurunniarningane taakkunninga eqqanayartissane amigarnittinnun kisiane gavamakku mappinganingin qoyaligutigitsiarakkit neriuppunga Minister Blair uqallaqatigigumnerniarakku kisukkannernin amigarsigutta mappingavikikkannerniarattigum tavvuuna so taana neriugittiappaqa ullu aggertuni uqallaqatiginiarninnin nalunersisimagatta sule piyassaqaratta. Thank you, Ken, in terms of the question. I am also very thankful in terms of the response that was provided with Minister Blair in terms of providing the nurses, but also the contact tracers. I think realizing the situation that we're in as a country globally in terms of the demand, in terms of the need right now for nurses and contact tracers is felt right across. So to respond, I believe there's an opportunity, and I very much look forward to having a conversation with Minister Blair, hopefully in the coming days, in terms of obviously our appreciation, but also highlighting key areas where if there is more support that's needed. So I very much look forward to working very closely with Minister Main. As noted, I think there's opportunities for us through the leadership of Minister Main to address key areas that were obviously outstanding. Sanitation in the nursing stations, hospitals is one area I think we could work within to identify, and I look forward to having a deeper discussion with Minister Main to addressing those gaps, among other things. So with that, I very much look forward to having a conversation with Minister Blair as the lead minister federally.
I'm a transfer to the Canadian Press. This is probably for Minister Main. my understanding is that the microbiology lab at the hospital here in Iqaluit is closed following the departure of lab staff last year. Can you confirm if that's true and why it closed?
I'm trying to Canadian press con ito sa sumamago na ang sibim mi kawi sabi matusimalam ningin ni te ko kanayak tino kalaw ningin na ni taman na suliba.
Dr. Patterson, I'm going to refer that question to Dr. Patterson, and maybe you could just ask it again for his benefit.
Surviving the pandemic, don't mess with Uli. So the difficulty is that, or the challenge is that a number of the staff who left were people who have the specialized skill in dealing, keeping a number of the microbiology tests going.
Ayom na ko tigiyang atak ko ano kalaw te kanayak te ma kawi mayitaw siya laki lang nga tatamak ko na niya ang sibim mi kawi sa akong nanang mo.
So many of the samples are having to be shipped south to be analyzed.
Just to follow up there, is there any action being taken to try to get that to reopen so we can process samples here in Nunavut?
Yeah, there are managers and directors at Akeeagok General Hospital are trying to recruit lab techs with the skills to do the analysis here in Iqaluit.
Ni tay ko ulat siyang yang yokhangi tay kan nakikita ni ana bimme ang sibim kanayak tin kawi saktin ni kanayak tita kaswakti man kawi sakkan nakataron naksikulu.
Teresa Kachuk, CBC News. Mamaya na nakalo natin ito apikilang gakko. Following up to Emma's question, Dr. Patterson, we have learned that the lab has not been undertaking microbiology testing, which is needed to determine the proper course for antibiotic treatment. If the lab is having to send samples south to get those results, what are doctors doing for prescribing the proper antibiotics in the meantime?
In those cases, they'll be using empirical treatment, which is general guidelines for using certain antibiotics or combinations of antibiotics to minimize the chance of having mistreating a resistant infection. And people may wind up being on those antibiotics a little bit longer as a result of if it takes longer to, when it takes longer to get those results.
Tema kanima yo haptilugo tamakko kawi saktaw sinalutir tema iyagakta titaw hattarne ato adjigingittuno tamakko no atemimun anna majutino kanimmat simayunu tema adjigingittuno kawi saksina hattaluti akune unaksa iyagaktare hatuinare harne ati tamakko utakhiningin ni tamakko nga kawi saktaw gutingin ullaktitaw simayun.
My next question is for Minister Gross. Ulla sa titirak view kausugo CBC kuno ilinyak di ukakauso December 13 mini suli fans kunni akilik tawlaw ngito CBC ko ilinyak tulakisik kuno apik sukuma hatta simalak tugalawa kasi ani kiugun nang ito si ukauti kun nakingas mga. We got an email this morning from a student saying she hasn't received funding since December 13. Can you tell us what's going on? Why is no one from education doing an interview with CBC or the media about this situation?
Quanah, for the question. I'm not sure on the particulars regarding the student or the situation, but I do know that the Department of Education and FANS particularly works hard to ensure that students do receive their funding. There are the student enrollment forms that the student needs to complete with their college or university to ensure that the funding is received. And if the individual emails me, I will look into the matter. Quanah.
Ayan na may tan pidyo tigilugo ilin na ati yung house skill jo tigilo ako nang itaka kasi na how yung mayuta ko ilin na ito lirayik ko tamalo ilin na ito no kino yak tigo ikayo sa ito lirayik tako kino yak tahatam ningin ni tako alo titira kaya kasi mata ilin na larin ningin ni tatati kaya ilin ni sila to sabi mi jo amilo ni kaya sumalakata kasi nakilak tayo katakon namin mata malutay na hakakisaw yak ko titira ko na to tahat sa mga how you get now?
Thank you.
Trevor Wright, Nunavut News. I got another question for Minister Gross. I already said my name. Have any of the schools or any education staff raised any concerns about reopening on January 17th at 24th?
Trevor Wright, Nunavut News. Kunilin na be sumalo na kaksumaba matitaw kanila in January 24.
Quanah, for the question. I'll be speaking with the DEAs tomorrow, so I'll hear from the schools if there are any concerns regarding the opening next week. But from my understanding, the department works closely with the CPHO to determine the risks of transmission of COVID-19 and any health-related issues. So right now, we know which communities are going to be at 50% capacity and which communities will be at 100%, determined by the CPHO and the number of cases in the community. So with that, the department realizes there are parents and students who might not feel comfortable, but the department has worked very closely to ensure that there are documents out there and information for the teachers and the students to go back to school safely. Quanah.
Kuya na may tako nunalin nilin na tulari kati mayeng ka pakati makatigila tangin ito sa digila tangin tako ilin na base malo ta mga ta pinasa ko sila tumi matuila amningin hanna ilin na tulari ko anna hamnang itulari marilo tako ilari katigit sa katakto upalong ayak so tinalian nilong nunalin ni kaya mayayo abay nanga ni matu upataw gunnaluti 50% nila tu ilang iatang luti matuila tu tako hatsiw ni nunalin ni nuwadyo naktuli malitaw luti at ko anahan nang itulay ni bajim makayo naluna si mayangi kaya magalo akto ko ang iyok kaya yo ilin na tilo smalo to hangata ilin na bimotek palle nang may kisani taman na jerit sa lugo kaya sa palle at sa angin na lang ayabo amalo to kasi ako tinitirak si mayok takaw lang taman na pekasiw timbi.
Next question is probably someone at health. Have there been any cases in any prisons or medical facilities? Like, have there been any outbreaks such as those?
No, what you anak to kasama ba? Ano lat sibin ni balwasing ni kanayak bigalan ni.
There's been I'm not aware of any transmission at this time. I'm not aware of any transmission at any correctional facilities. We are aware of a couple of instances of individuals who work at health centers contracting COVID-19. It's unclear whether that transmission was from a patient to staff or between staff or at the places where the staff live.
Kaui mangito tu sa mangito sa mapalayo kas mga ikayok tawin ni ano lat saving ni kasi ni maro ne tu sa mayo kanaya tin ni ana be mino va jana ta tu mini yo ni kasi ni tu kasi nang ito ana bela te mo sa mabiyo ng mga balo kanaya hating ano sa mabiyo ng mga taman na tu kasi nas mangito.
This is another question from Melanie from Nunavut News, and it's for Minister Quassa. Minister Quassa, what can the radio stations use the new funding for? Will the Department of Health send radio stations specific information to give the community, or will this be the support community-led, or will this be to support community-led reporting?
Melanie Nunavut News kun ni Minister Quassa ta ko ki na ye atu no titaw na alat no na lid ni no na law to habin no piliri sinni kisa mo lakin na mga ta nalo na yakam na obi
kuyan namik ta ko ki no ye atok to yun na mata o ka so ka ni ingi ka juti kan no na mata na raw ta ka ving no na rinne imma ka akilas swingon mood o kalakti o katakto ubaruni takwa naraw ta kavinga inga katyaw na naman. The funding that has been announced is to cover operating expenses such as salaries and purchase of equipment if need be.
Kent Driscoll, APTN National News. Dr. Patterson, please. Dr. Patterson, we've gone through this a couple of different times in a couple of different ways, but with schools reopening a week from today, it's probably worth going through. If a student tests positive in a classroom, who will be informed? Will it be just the close contacts of that student who are sitting next? Will it be the parents of everyone in the classroom? Will it be school-wide? If a student tests positive, who finds out?
Kentres ko APTN kun ni ta na periyo katak mayo ilin na be matu ilalak tilugit ilin na me no va jo nak ta to ham na kakik ko hawi sakta ga yakha khani gi jay nangi to balo ang yo kha ga yo ta ko ilin na khating ta kik ko hawi kakta ga yakha.
As always, the student and their parents find out first before we make any other announcement or any other efforts.
And
then begins the contact tracing and the risk assessment, and it very much depends on the exact circumstances. But if there's concern that students have been exposed in a class, have had high-risk contact, and by high risk I mean high risk of transmission, we'll contact the parents as part of the contact tracing. If it's impossible to do that, then we would opt for an exposure notice if it was needed.
Ajigi hatta jangi tu galo kisana ang yokha ya yuta khawi katawin na hatta lang ayui.
Thank you, everyone. That concludes our media conference for today. We'll have another one on Thursday at 11 a.m. And in the interim, we'll be sharing any updates via the Government of Nunavut's regular communication channels. Have a wonderful day.
Sitä me takut saakan niillä ahtui.